I want to introduce you to my daughter. This is Teagan. Teagan is 7.
And this is my son.
That is Blaze. That is Teagan's therapy cat. We thank God for Blaze every day. He is so special. So we wanted to send this to you because Teagan is a very special little girl. Teagan has 2 autoimmune disorders. One is called eosinophilic esophagitis. It's a very long name for a really scary disorder. It's a very painful condition of her esophagus. So Teagan can only eat 6 foods right now. And when we trial a food, or if she eats something and she has a reaction, she can have a couple months of nausea and vomiting, food impaction, abdominal pain, chest pain, reflux. She also gets high fevers and joint pain. So it's miserable for her, and she's had this her whole life, so she really doesn't know any other way of living. She also has a G-tube that goes into her belly, and we can give her extra nutrients that way, her formula. If she gets dehydrated, we can give her fluids, and we can, most importantly, give her her medication. Yes. Oh, I'm sorry. Blaze is falling asleep right now. Yeah, Blaze. 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 So the other autoimmune disorder that Teagan has, was diagnosed about 3 years ago, and it is called PANDAS, just like the panda.
I forgot the name.
Autoimmune encephalitis. Yes, autoimmune encephalitis. So PANDAS is kind of a cute word, even though it's not really a cute disorder. That stands for a pediatric disorder in which an illness, a virus like a strep infection, crosses the blood-brain barrier and enters her brain. It's very similar to the way rheumatic fever would affect somebody's heart, but it affects your brain instead. And they're actually looking at trying to change the name of this just because PANDAS, I think, sounds a little too cute, right? Yeah.
A little too cute.
A little too cute.
Right.
So they are thinking about, it is an autoimmune encephalitis. So it's an inflammation of her brain. It affects the area of the brain that really controls OCD, depression, anxiety, separation anxiety. What else? Fears. Fears is a big one. Tics, she has a lot of regression, school issues, headaches, lots of things that aren't fun. It also causes extreme rages, which if you look at this little peanut, she looks like a sweet, sweet girl, which she is. But when she has a rage, oh, hi Blaze. When she has a rage, she turns into a truck driver, which requires several people to restrain her. So it's a very scary disorder. And we are in the process of trying to get her treatment. It's a very expensive treatment. Unfortunately, it's not well known yet as far as insurance codes and things like that to get coverage. So a lot of doctors don't accept insurance and a lot of treatments are not covered. So we are in the process. We have a GoFundMe site set up to try to raise money to get Teagan the medication that she needs, which is actually used for cancers and MS. It's an infusion that we are going to Washington, D.C. to get. So we are writing to you for a couple of reasons. Most importantly, Teagan loves you. We both love you. We love watching your show. And Teagan loves the fact that you love animals. She is a big animal person. You want to tell her how many animals we have? Okay, go ahead.
I have 5 cats, 1 dog, 1 rabbit, 1 ferret, 2 hamsters, 3 fish, 1 turtle. What else? What else?
Did you say the rabbit? You said the rabbit.
Yeah.
And we do have a pig, but the pig is living on a farm right now. Oh, Blazy. Can we see Blaze? Blaze is just the best therapy cat ever.
Come here.
Yes. So she just admires you so much and the work that you do with animals, and so do I. We both love animals here. So number one, we just love you and we wanted to say hi. Number two, we wanted to try to get the word out about this disorder because so much is unknown about it, and there's a lot of controversy out there about it, which is unfortunate. A lot of kids are being diagnosed with psychiatric issues and being put on very high doses of antipsychotics and antidepressants when in fact this is not a psychiatric problem. This is a medical issue with the brain. So that is a very big issue that we deal with on a daily basis. The other thing is it's not, like we said, fully recognized yet with some insurance issues and things like that. So families are needing to pay out of pocket daily for treatment for their children. So lots of issues right now, lots of controversy, and the bottom line is our children are suffering. Our families are suffering. The amount of caregiver strain that this brings on a family, I can't even begin to tell you about. It's 24-hour care, pretty much, that they require, even though looking at Teagan, you can't see that anything is wrong with her. When she has a flare, it's significant. And a lot is going on inside of her, things that we can't see, her esophagus, her brain. We can't see those things, but there's a lot.
Can't see.
Yeah. We can see Gus. We call the esophagus Gus the esophagus. We can see him with an endoscopy. So we are really trying to just get the word out. Even doctors, I think, a lot of doctors have a hard time understanding truly what this disorder is. We've gone through one in particular very traumatic hospital experience where they really treated Teagan with a psychiatric illness and, in my opinion, medically abused her. She was just punished, which leaves a lot of PTSD. So those are two issues. The last one, of course, is we are in a major financial bind trying to find and fund money to get her treatment. It is in Washington, D.C. We live in Massachusetts. We found a fantastic doctor, and this treatment can not only benefit her PANDAS, but also can benefit her eosinophilic esophagitis because it basically reboots the immune system. So this could help her in a number of ways. So that's kind of our story.
Can we show her Olive?
Olive is our hamster, one of our hamsters. Yes, we can show you Olive.
Because he's now bouncing around the room.
Here, Olive.
Olive.
Where are you?
He's right there.
Let me see you.
Hey, little baby. Do you want to go back out in the chicken pen?
So Teagan, come here.
Hey,
Really quick, because I have to say, as Teagan's mom, Teagan is the bravest, strongest little girl that I have ever met, and I couldn't be any more proud than I am of her. I'm a nurse. I've been a nurse for 24 years, and
Longer.
no, not longer. 24. I'm not that old. 24 years. And I have never seen anything like this. It's just devastating to watch, and to be in a situation of feeling so helpless, getting support and financial support and every other kind of support. I can't even begin to explain. So just really quick, can you tell Ellen in your own words what it's like for you?
It's scary.
Scary. Yeah.
That's all I got.
It's okay. That's enough. All right. Well, we love you, Ellen, and we hope to hear from you. Maybe even just to get some knowledge out there for people and tell people what this is all about. So thank you. We love you.
Bye.
Bye.